Veterans Association. Not present. American Ex-Prisoners of War. American Legion. AMVETS. Thank you, George. DAV. VFW. Vietnam Veterans of America. Waves National. Women Veterans of America. Okay, I do detect a quorum, so I will call the meeting to order. Please stand up, and Wendell Cheek will lead us in invocation, and we'll follow with Pledge of Allegiance by William Crawford.
Please bow with me. Our Heavenly Father, we come to you today asking for your guidance, wisdom, and support as we begin this meeting. Help us to engage in meaningful discussion. Allow us to grow closer as a group and nurture the bonds of our veterans community. Fill us with your grace as we make decisions that affect the veterans of this great state, and continue to remind us that all that we do here today, all that we accomplish, is for the pursuit of truth, for the greater glory for you. We ask that you watch over each organization represented here today and for our safe journey home. We ask all this in the name of Jesus Christ. Amen.
Have your seats. Okay. You all should have received the minutes of March 24th. Do I have a motion to approve the minutes? We have motion and a second. Any questions or discussions or edits? All in favor of approving the March minutes indicate by saying aye. Opposed? Minutes are approved. Thank you. We start with, are we up? We are up and running, so we are live. Just in time for Director Charlene Ehret from Mountain Home. Thank you again, Director Ehret, for making the long trip here. And thank you very much. Could you make sure your mic is on?
I will. Can you hear me? No? Hello? There you go. Good afternoon, everyone. It's great to be here. It's not a very long drive, but it's long enough. That's right. So I'm really happy to be here today and talk to you about my favorite subject, and that's the Mountain Home VA healthcare system and the veterans that we treat. Now, I have a brief overview of the hospital. I will promise to give you plenty of time to ask questions about anything you choose, current events, and will promise to be as open and honest as I can be. So you can see that at Mountain Home, we have over 2,000 employees, and about 30% of our veterans our employees are veterans. We have 179 mental health employees. We have a budget of about $370 million and over 1,200 volunteers. Now, I always like to show pictures, so I've shown some pictures. I don't know how well you can see them, but we do have a beautiful campus as far east in Tennessee, just about as you can go. We're just over the mountain from South Carolina, but it is a historic site and really is a very beautiful campus we share with the cemetery, and it's a nice visit. If you're ever up there, it's a pretty place to visit. We are on the historic register. We're very proud of that. We treat about 55,000 veterans. We've had about a 1%. We really have been staying pretty well equal. We haven't seen huge growth. We haven't lost veterans, but we have increased about 1%. In FY13, we had over 600,000 outpatient visits and 5,500 inpatient days, or patients treated. We completed 7,000 surgery procedures, that's both in and outpatient. We had 105, almost 106,000 mental health encounters. We have treated 353 community living center veterans. Who we serve all veterans of every era, but you can see that over 25,000 of our veterans are Vietnam veterans. As they get older, they require more. As we get older, I should say, I'm not a Vietnam veteran, but I am married to one, and he's getting older. I tell him he is, I'm not, but and require more care. And you can see we have close to 5,000 of our newest veterans and about 15,000 if you count Desert Storm and OEF. This is a picture of our access. You can see Mountain Home there in East Tennessee, and we have clinics in Bristol, Rogersville, Norton, Morristown. Knoxville, of course, is our largest clinic, and Sevierville. We are opening a clinic coming up next 2 weeks in Campbell County, and I think we are hoping that clinic can take some of the patients off of the Knoxville list and opens up access in the Knoxville clinic. Really, our growth is in Knoxville, and we've not had the opportunity to expand space in Knoxville, so we've done everything we can to pull the patients that are traveling some distance, either to Sevierville or to Morristown or to now Campbell County. So we're adding a clinic in Sevierville this year that's been approved and is under design now, and both of those will be a new team of primary care providers. We are award-winning. I have said that here before. I'm very proud of that, so I have to add it. But we have won the VA's highest quality award, the Trophy Award. We have been recognized by the Tennessee Center for Performance Excellence 2 years. We have won the Achievement Award, and we are one of the Joint Commission's top performance on all 4 of the key quality measures: heart attack, heart failure, pneumonia, and surgical care. I might add, I'll go to the next slide. I'm not sure if you've seen this slide before, but this is a slide that benchmarks the quality and efficiency of our services and compares it to VA and non-VA sources. And it's sort of a mixture of the Trayvon model, the CMS measures, and Leapfrog. And you can see that the blue is good. We are a 5-star. That's 5-star of 5 stars. So we're very proud of that. I would like to point your attention to that little middle blue dot. I'm very proud of that, and people are very tired of me pointing that out. But that is patient satisfaction, and that is the best patient satisfaction scores in our system, in the VA system. So compared to other VAs and compared to our community, we do have incredibly happy patients, which we're very proud of. These are domains around there. You can see the satisfaction, stay, adverse events, mortality rates, performance measures, morbidity, access. You can see that access is yellow there, and I may not have the FY12 measures, but since that's what's in the news, that we measure access, so we really do keep track of how many of our patients are waiting longer than the VA guidelines or VHA guidelines, efficiency in hospitalization, but in each of those domains are a number of metrics. And you can look at the next page, and that's the larger picture of all of those domains broken down by metrics. Anyway, blue is the best, green is good, yellow is average, orange is not so good, red is the worst, and we're very proud that there are no reds there. But I can tell you that in our FY12 chart, access was a red. And you can see that we've worked very hard over the last 3 years to get our access under control. I'll talk about that more when we're talking about access, but we're very proud of our patient safety. We have great infection control results. We have 0 ventilator-associated pneumonia for the last 3 years. We have had 0 central line-associated bloodstream infections since FY13. So we're very proud of that. We continue to work on improving our services. We have created private rooms for all of our veterans. We have 2 or 3 double bedrooms for patients who need to be cohorted, but for the most part we have private rooms and private baths with sleeping arrangements or a sofa sleeper for families throughout our hospital. We have completely renovated the community living center and continue to add space there as we grow. I think I announced this last year, we have started valet parking for our patients, and we average about 350 cars a day in valet parking. We have 54 PAC teams, and I think you probably have heard that's patient-aligned care teams. Those are our primary care teams. They really are a team of doctors and nurses who work together to meet the patient's full continuum of needs. We have implemented mental health integration, so most of our primary care teams also have mental health services now a part of their team. And that we still have the acute mental health services, but for the everyday stressors that we're all feeling, you can now get some of those services and care while you're seeing your primary care provider. And our patients love that, by the way. This is just a few patients of some of the things that I've shown you. You can see the CLC down here. We're very proud of that. The private rooms really create a very nice environment for our patients. Some of the upcoming projects, we're really looking forward to opening Campbell County on June 16th. You all are invited if you're up there, but it will be one panel, one team to care for those patients. We have already identified about 500 patients that are currently receiving care in Knoxville that will transfer their care to Campbell County. So that frees up the Knoxville clinic for additional patients there. We are finally going to have I have valet parking for patients, but I can tell you that I get just as many complaints from my employees about parking, and we finally have gotten approval for a parking garage that we are starting on design and hope to have completed in 2016. We are expanding our HEMOC unit and working to create a center of excellence for the care of oncology patients. We will double the size of our oncology unit, and we will have that completed this year in 2014. We have been approved to increase the size of our intensive care unit, so that will be happening in FY16. We'll move it to a new location. While we're in construction, we will continue in our current ICU and create a new ICU in a new location. We have a lot going on this year. We're expanding the emergency department. It's not a major project, but a major mess it will be. We'll do it in phases, close it pieces at a time to try to avoid closing the emergency department. But We have been cited for having too small emergency room for many years, probably since I've been here. And this has been one of the more difficult projects to get underway, but we're designing it and we'll start construction next year. And then I mentioned the expansion of Sevierville. We're adding another PAC team and a home-based primary care team in the Sevierville clinic, and that will be finished this year as well. And again, the Sevierville clinic will be about 1,200 patients. We'll be adding to there. We'll be adding about 1,200 patients to the Campbell County clinic. So we are creating more access for veterans in our area. This is a picture of the new clinic in Campbell County. And this is a hopeful picture of the parking garage. This is some expansion in hematology, oncology, and the ICU. And then the emergency department will really change the whole emergency entrance of the hospital. And then some of you may have already seen the Sevierville clinic, but there's a picture of the Sevierville clinic. We do have a strong affiliation with East Tennessee State University College of Medicine and College of Pharmacy. They are on our campus. They're on the far end of our campus and are beautiful as well and part of the historic, follow the historic tradition of our campus. We have 350 medical trainees, 110 pharmacy trainees, and 460 associated health trainees. Now everybody's interested in wait time. I know that we were in USA yesterday about being in the top 25 of the longest wait lists, I think it said, in the VA system. I actually have not seen that article, but only emails of it. It said, unfortunately, that Tennessee Valley was the worst, and we were 20th or something with a 35-day wait time. Tennessee Valley with a 65-day wait time. We have not been able to find where that number came from. Nobody seems to know where that number came from. But I can say that in 2011, we actually had a 93-day wait time. We opened Sevierville in 2012, and since then we have run about 22 days, our average wait time today, or as of May 13th, we were 8 days. I will say that it changes every day. Again, I don't know where the 35 days came from. I think 35 days is a long time. I don't think that's exceptionally long for a primary care new patient visit. But we work very hard. We're very access focused. I know I'm really into patient satisfaction, and I know without access you don't have good satisfaction. Now, the unfortunate thing is we have great patient satisfaction, but it's hard to measure the satisfaction of veterans who aren't currently in your system. So, but I will say that we had our site visit on May 14th and in Knoxville, May 13th in Mountain Home in Knoxville, May 14th. This week, they're looking and finishing up the site visits in all of our CBOCs. So the VA system has made a commitment to look at every single access point, and I think there are over 500 of them in the country, to look at the way we are scheduling patients and keeping track of wait times. We have set our own targets, but they are targets that we have set. When they were at Mountain Home and Knoxville, they found no issues of integrity. They found some confusion. Some definitions were interpreted incorrectly. We were putting patients on a waiting list that didn't need to be on a waiting list, and that would have exaggerated the waiting list. But it was just a question of should it have been on a recall list or an electronic waiting list. And I will say it all sounds so simple when they say it in the newspaper, but it's very, very complicated. We have built in a system of eligibility and criteria, and certain patients may wait longer than service-connected patients, POWs. There's a certain class of categories of patients don't wait any time. If you're priority 8 or you are new in the system and priority 6, you may wait longer than a service-connected patient would wait. But I know that we keep track of it. I think we get an email every 2 weeks about what the current wait times are, and we take it very seriously. There are also some confusion about the create date and the desired date, and I think even the president mentioned that. I was very impressed that he seemed to know the difference between a create date and a desired date, but the desired date really falls within a perimeter of when the doctor wants to see you back. The doctor may say, I want you back here in 6 months. The patient may say, well, I don't want to come in 6 months. I want to come next week. And the doctor may say, well, or the clerk may say, well, we don't have an appointment next week, but the doctor does want to see you on a day of your choice in 6 months. So that's the confusion between the desired date. The patient wants to come. You get to choose the desired date within the time frame that your doctor has asked to see you back. I will say that we at Mountain Home we think, it changes every day. I would say even on the way down it kind of changed today, but we don't need any dollars to meet our need for patients to be seen. It's not a question of money for us. It is a problem with space. Knoxville continuously has a wait list, and we're continuously looking and squeezing in more people into that clinic, and we've run out of room. And we are working on an interim lease. We are hoping that Campbell County and Sevierville take some of the burden off of Knoxville, but really Knoxville is our challenge to be able to meet the needs of the veterans in that area. We have some problems with recruitment, although that has really lessened these days as more and more doctors are wanting to come and work for the VA. And we have some problems getting certain complexity level employees because of our pay structure. And we have a different waiting list, or a waiting list of patients who are waiting to go, that are being seen at Mountain Home, currently waiting to be seen at the Knoxville Clinic. So we do ongoing, we have now reviewing every single patient that is waiting on the EWL and the exceptions list, and that's for existing patients, not new. We are calling every single patient to assess their need for care and to see if they need to be seen sooner. And we are feeing out when we need to, or overbooking, or creating weekend clinics, and doing everything we can to meet the needs of any veteran who may be waiting for their care. I just have my one final picture is a picture of the veterans who work for the Mountain Home VA healthcare system. And again, we're very proud, and we really do think that it's their services that result in the good care that we provide and in the good satisfaction scores that we receive from our patients. I tried to do that quick. I hope it wasn't too quick, but I wanted to be able to answer your questions if you had any. And I know you have to have some.
And before we take those questions for Director Ehret, I do want you to know that we also have the pleasure of having Director John Patrick, who is Director of VISN 9. VISN 9 encompasses not only all of the 4 Tennessee medical centers, but also several other states' medical centers as well. So he'll be following Director Ehret. So please just focus your questions on her
Maybe
facility.
should let him go on, and then I'll be around to answer questions, because
We
he does
could.
have another
Is that okay?
that he needs to get to. Is
Sure.
that okay?
Thank you, because you're going to stay through the end of his. Okay, great. Well, so there's your introduction, Director Patrick.
Well, I think what I heard you just say is I'll take the tough questions. Is that what you-
I think that's probably unanimous. But thank you so very much. I know you wanted to be here in March, but when we changed the date of the UTVA due to weather, couldn't make it. But thank you for coming now. Thank you so
Absolutely.
much.
Thank you, Commissioner. And thank you, folks, for having me here today and presenting this opportunity. A year ago today, I loaded my wife and my cat up in my truck and started a long journey across the country from the Portland area out on the West Coast, where I served as the Medical Center Director at the Portland VA Medical Center. I thought that was the pinnacle of my career. I thought I would retire there. I'm retirement eligible. My son was in the Navy. He has 3 little hostages that he keeps from me, and he's in the Navy down in Jacksonville, Florida. So my wife and I looked at where we're at in our lives, and we said, let's see if we can get closer. This was the network. In all honesty, this was the only network job that I had any interest in. My son had told me previously when he leaves the military, he wants to retire to this area. I want to be here when my grandchildren get here. So it actually worked out beautifully. And I can tell you, I don't think I could have made a better choice. I think I've come to a great network, a wonderful opportunity, great facilities to work with, and a great relationship that I want to talk a little bit more about in a minute. Also served in my past VA life as the director at the Salem, Virginia VA, and as the interim director at the Asheville, North Carolina VA. So I know this part of the country somewhat. I've worked with veterans from this geographic area. Last summer, I spent pretty much most of my summer getting around to all of our major sites of care. I'd like to tell you I've been to all of them, but I haven't been able to do that yet. But I have tried to get to at least our hospitals and our larger clinics. I've been able to do that. And going around visiting, I found out that we have a wonderful set of facilities that serves the veterans in Tennessee, Kentucky, the western part of West Virginia, and also have clinics that extend into the surrounding areas. Excuse me. The surrounding areas as well, like Mississippi and some down in Alabama and Ohio even. But I think one of the things I heard over and over again is you have these great facilities that don't necessarily work as a population health center for all the veterans. Each one individually does some things very well, but they weren't working as well as they could together. So we determined at that time, let's put something in place that will encourage that working together. So we formed service lines. And if you're not familiar with service lines, that's where you have overarching services that we have leadership take responsibility for guiding that within each one of our facilities. It does not relieve directors of the responsibility of day-to-day operations. What it does is it offers the opportunity for us to share best practices across the network. I'll give you a clear example of one of the service lines is Ms. Ehret's service line for Mountain Home. We wanted patient-centeredness to be in the forefront of everything we do at all of our facilities. She, as she expressed to you, has the best patient satisfaction scores in the nation. So I told her, Charlene, you're in charge of the service line. I want you to work with all of our other directors and make sure those best practices are put in place at all of our facilities. So we have 6 service lines. We have one for primary care, one for mental health, one for specialty care, and Director Morales right here at Tennessee Valley also has that responsibility. We have one for geriatrics and extended care. We have another for pretty much it's work-life health, you know, the well-being of our employees, how to make ourselves an employer of choice. So have the 6 service lines. Each one of the directors has a service line. They share that responsibility with the leadership at the local level. And that actually has been working out very well. We're just charging out of the gates with that new structure and getting those best practices shared amongst our directors. And we're coming up on our first strategic planning retreat later in the summer, where we'll really get to the business of sharing that. So in late summer, I had the opportunity to meet with Commissioner Grinder She came to my office, and we found out we had a mutual acquaintance. She shared with me that one of my old friends back in Oregon, Jim Willis, was a mentor of hers, and both shared some fun stories about Jim Willis and the relationship there. I made the statement when I was in Oregon that I thought that the state of Oregon did a better job than anywhere I'd ever been in taking care of veterans, as recognizing it takes an entire community to take care of our veterans. I was so enthused when I came to Tennessee, met with Commissioner Grinder, and she shared that same enthusiasm. And I think that's why it's so important that we have a transparency, we have a relationship. I spend time telling you very clearly what's going on with our veterans in this very large population that we serve, and how we can work together to provide the services for them. The VA cannot do it all by itself, nor could the state do it all by itself, nor can the veteran service organizations do it all by itself. But all of us working together, we can do incredible things to serve our nation's veterans. So I look forward to continuously working with you. I look forward to coming here on a routine basis to talk with you, find out what your interests are, find out where we can do things better, because that's really what we're all about. I know my medical center directors have direct relationships with this group as well. I encourage that. Healthcare is local, and that's where I want to keep our healthcare and those interactions. That if you have an issue with one of our facilities, by all means, bring it to the attention of the leadership there at that facility. If you don't find satisfaction, then my door is open. I want to know about it. I want to sit down. I want to talk to you, and we'll make those opportunities happen. So I think the timing for this, for me to be here today, couldn't be better. VA's been in the media lately. You probably have seen that. There's been a few questions about the way we do things. I think there's been some really good things, despite this pain that we're going through. There's some good things that are going to come of it. One of the things that I don't know if you watched the testimony when General Shinseki testified to the Senate. The veteran service organizations were there. Across the board, the veteran service organizations that were there said what we know. The quality of VA care is very good. It's comparable to anybody in the community, and Ms. Ehret showed you, we compare ourselves with outside organizations that come in and look at what we do and how we do it, and make sure that we're hitting those high standards of care. Are bad things going to happen? Absolutely. Healthcare, bad things are going to happen, but it's our job to systemically try to put in place methods and systems so that it happens as rarely as possible. The ideal, of course, is that it never happens, but the reality is bad things are going to happen. So quality of care, I think we all agree, is good. The issue is access. And I don't think access is anything new to any of us. We've been talking about this for quite some time. I think how we talk about access and the reality of that access and the challenges surrounding that we have put on our frontline staff needs significant improvement. And I think everybody within our organization recognizes that, and we need to move out to do better with that charge. VISN 9 is a high-growth network, especially here in the southern tier. Our largest growth is here in central Tennessee and at eastern Tennessee, where we have Mountain Home. Those areas are challenged with more veterans coming to us for care. That's what we want. That's why we're here. But the reality of the work is we've got to run to keep up with it. And we've got to battle to make sure we get the resources here in place to provide that care. I think we're doing a good job of that. Although, in all honesty, there are significant wait times that we need to deal with. Nothing like you read about in USA Today. In fact, that 65-day mark for Middle Tennessee, I've had my staff working for 2 days trying to figure out where did they even get this number from, and can you recreate it? Looking back in time, where would have that come from? There's a possibility, as Charlene stated, that from several years back, that might be an accurate number, but it is not accurate today. The number that I saw today for Middle Tennessee was an average wait time for new patients of 31 days. Now, I will tell you there's certain clinics where we have access issues, small rural clinics here and there, and some of our larger ones, like Chattanooga, Knoxville, where we're having a difficult time because of the overwhelming number of veterans wanting to be treated there, where that access is longer for new patients. But I also tell you that this team's working every day to try to resolve those issues. They're multifaceted. Chattanooga and Knoxville, this isn't new to us. We've had plans on the table to expand both those clinics for quite a while. And yet they're tied up in legislation. And, you know, we're going to keep pushing to try to get them out of there, but we're not going to wait either. As Charlene mentioned, we're going to look at, can we lease some space on a short-term basis to open up more access for those veterans in Knoxville. Same challenge in Chattanooga. Clarksville is being overwhelmed right now. If you go up there, we're shoehorning patients in there. It's not the optimal way to provide care, and we need to expand access, and we're going to keep working at that. Within the last 90 days, we've opened 3 new clinics in VISN 9. Just yesterday, had a grand opening up at Bowling Green. I opened a clinic in Athens, and I believe the other one was Roane County. Is that right? Yeah. So sometimes I'm not paying attention while the staff drives me someplace. I'm doing some work and look up, and I'm kind of like, where are we? You know, so I'm still discovering parts of Tennessee and Kentucky. So I'm going to share with you just a little bit of technical information if you bear with us. I think it'll help you give an idea of where the challenges are. So there's been a lot of talk about secret waiting lists and stuff. And I'm not going to tell you that that's not possible, that somebody lacking integrity might have had a list trying to pad for whatever reason, for performance measures or whatever. That might have happened somewhere. I sure hope it hasn't happened in VISN 9, but I can assure you if we find out from these IG reports coming in that we're hoping to get back soon, we'll take action. And we will hold people accountable. It's not the culture that we're promoting here in VISN 9. I've had the great satisfaction to be able to hire 4 of our 6 directors. The other 2, Juan Morales and Charlene Ehret, I've known for a long time. I know them to be people of integrity. When I interview for new directors, like yesterday I was interviewing for the new director at the Louisville, Kentucky VA, I talk about culture. I talk about integrity. These are the things that are important to us. If we have those and we put the veteran first, we don't have to worry about the performance metrics. Do we want to be top performers? I take for granted that at this level, if you're here for a senior executive position, you've demonstrated a capability to accomplish. But you better have done that with integrity, or else you're not going to be part of our team. And so that's my promise to you. If I find that somebody has lacked integrity in this process, I will address it. It won't take the Secretary of VA or anybody else telling us this is what we need to do. I will address it myself. What we are finding from the reviews is there's a lot of confusion with the frontline staff. When do we use a wait list? Is it okay to use another wait list? We have different types of wait lists. I'm going to share a little bit with you, but all of these are supposed to be transparent so we know what the demand is. And I don't think we communicated very well to frontline staff that the wait list, the scheduling package, is not just for scheduling veterans. It's so leadership can know where there's excess demand. And then we can make resource decisions to respond to that. Some of the staff, we're finding, created their own wait list because they didn't have faith that the electronic wait list was going to capture that veteran was waiting. And they wanted to try to do favors for veterans to make sure that they could squeeze them in where they wanted. It was with the best intent, but they were defeating our purpose of knowing where that demand was so we could make those resource decisions. So I'm going to share with you a couple definitions here if you'll bear with me. The electronic wait list. You've heard all about that here lately. The electronic wait list is the official Veterans Health Administration wait list. It's not to be confused with the Veterans Benefit Administration backlog list. 2 different things. The electronic wait list is a list of patients waiting for an appointment or assignment to a primary care provider or team. It is used to keep track of new patients, not established patients, new patients who have requested care but cannot be scheduled within 90 days. The electronic wait list is maintained on the VA computer system for use by staff. And the electronic wait list has been in use at VA since 2001, so this isn't new. It's transparent. Folks know where this is, and if you ask me, you know, we can tell you what our electronic wait list has on it at any given time for all of our sites of care. And you may have a long wait list at a small rural county clinic, and you may have great access, you know, at another clinic just like it across the state. It's a very dynamic situation, as Charlene was saying earlier, but we're constantly working that and trying to stay on top of it. So how does the electronic process work? The electronic wait list is used to list patients waiting to be scheduled or waiting to be assigned to a primary care provider or team. The electronic wait list is used to keep track of new patients, those who have not been seen before in that specific clinic in the previous 24 months, for whom appointments cannot be scheduled in 90 days. Electronic wait lists assist VA medical centers and clinics in managing veterans' access to outpatient health care. When a new patient requests care, every attempt is made to give the patient an appointment within 30 days of the desired date. That's the date when the veteran wants to be seen. If a patient cannot be scheduled for an appointment in the next 90 days, they're put on the electronic wait list. That tells us we have demand in that area that we're not able to meet according to our own timelines and specifications. The electronic wait list allows patient appointments to be made as soon as clinic access becomes available. So they're constantly working that wait list. It's not that, you know, you're absolutely going to wait 90 days. If a clinic appointment comes open because somebody else can't make it in or cancels their appointment, we're going to contact people on that wait list and try to get them in before the 90 days. The electronic wait list allows managers to see areas of increased appointment demand and make decisions about how best to accommodate the patient's needs, including when to purchase care outside of VA. And then there's another list. And this is, I think, what folks are thinking there's some secret kind of list. There's another list called the near list. And the near list is a new enrollee appointment request call list. It's a mouthful, but we call it near. Now, shockingly enough, when somebody brought up the near list a couple weeks ago, I said, "What's that?" And I turned to all the people that were in the room with me, and there was a lot of confusion about what exactly is the near list. But it's actually there in VA policy that we have this capability, and this is what the near list is used for, is to be used by enrollment staff to notify schedulers at specific locations that a veteran has specified a preferred location and requested an appointment during the enrollment process. So in other words, a veteran could be here at Tennessee Valley at the enrollment office and say, "I want to be seen in Clarksville." Clarksville right now doesn't have very good access, so they might have to go on this near list. That's a list that would be sent specifically to that site of care. So if an appointment comes open within the next 90 days, they can get them in for that care. And then there's a third list. And you haven't heard this one talked about anywhere. This is called the exceptions list. An exceptions list is a veteran that says that has enrolled for care. It's a new veteran. And they can't schedule them within 90 days, but the veteran says, "That's okay. You can see me after the 90 days." So they don't go on the electronic wait list. They go on this exceptions list because they have an appointment that's scheduled, and that's the appointment they agreed to. And now, I don't have to tell you, trying to manage that with our frontline staff, and we have done training. We've done training with every one of these scheduling people. Every new scheduler we bring in, we train them before they start this process. But when you get into the whirlwind in some of these clinics of the number of patients coming to you, it's too confusing. And we need to fix it. And nationally, I can tell you, we're going to be taking this on and trying to come up with a much easier way for our staff to manage this. Bottom line is we have an electronic scheduling package that's not working for us. It tries to do too much. It's tied into the patient record. It's tied into our DSS systems. It's tied into, not in other words, not just a scheduling package. And that's what we need. We need something that just clearly says, when does a veteran want to be seen? Where's the open slots in the clinic, and how can we get them in there? And that's what our staff should be working with. So we are having the site visits. We're getting a good feel for this across the entire country. We're going to get the report back. We got a preliminary report. You've seen that preliminary report. It told us what we figured you would find, that it's a very confusing process. Most of the staff involved in this are not doing anything untoward or illegal. Most of them are making mistakes because it's very confusing, and we've made it too confusing for them. So, as I promised, we'll be following up nationally. We're going to be coming out with a different process. We're going to hold those accountable that have gamed the system. And hopefully within the next 6 months, we're going to have a much better product for scheduling patients. 87 million patient appointments were scheduled by VA last year. That's a lot of scheduling. Most of those happen flawlessly. It goes just the way you hoped it would. But that's not good enough. We need to do better. And we need to fix this thing. We need to make it easier on our staff. And we need to make sure that we don't have veterans falling through the cracks for care. So one other thing I want to touch on before I take your questions. VIC cards. Everybody's familiar with the VIC card, the Veterans Identification Card. That when you go to a VA hospital, you have the card right there in front of you. We have a new card coming out. Anybody know what it's called? It's called the VIC card. But there is a small change to it, where before it was VIC, standing for Veterans Identification Card. Now it's VHIC, standing for the Veterans Health Identification Card. Why are we replacing the cards? Because the old cards had too much personal information on them, on that metallic stripe. It had Social Security numbers, date of birth, a lot of things that were, identifying information. But the new VIC card also has some capability that the old card didn't have. It's going to have more information about your member ID and the branch of service that you served in. It'll have a unique identifier for your health care plan. So it's almost like your insurance cards. It'll have a number, but that number wouldn't mean anything to anybody else except for you and the healthcare system, rather than having your Social Security number on there. We hope to roll those out in July. And this card, like the old card, would be something that is, you can use at any VA site of care. So looking forward to that and getting that in the hands of veterans and getting those old cards collected where we have that risk of sharing their information. With that, I'd be happy to answer any questions that you have.
And as you pose your questions, please let's just get to the question and try to shorten the story ahead of time, and so that way more people can ask. So, any questions?
Sean Poston, Wounded Warrior Project. With the exception of benefit backlog complaints, the access complaint is the one that I get the most from Wounded Warriors. So the question I have is, when you were talking about the list and the information provided that said that the warrior may be assigned to another hospital of his choosing, is any of that information shared with that warrior in advance that he may be making a wrong choice to get quick access to an appointment? Is that being told him up front? And the reason I ask is because I came from a different vision to here. I'm a service-connected veteran, and when I checked in Tennessee Valley, they told me it would be 120 days before I was seen for a primary care appointment. It was not until I visited the emergency room twice for refills of medication that the clerk at the emergency room said, "Hey, do you want to be seen down at the Charlotte Avenue Clinic?" And I said, "Where's the Charlotte Avenue Clinic?" And she said, "Well, it's just a few blocks away, and I can get you in there next week." She's the first person that said that. Not eligibility, not enrollment, not any of those folks that I'd spoke to on the phone or in person had gave me that information, but the nice lady in the ER knew how the system worked. So how much of your upfront people that are counseling these warriors that are coming back are giving them that information? Because I do have a lot of complaints, and it's not 20-something days for a service-connected veteran that I'm receiving feedback on, because all of my warriors are service-connected veterans, so they're priority ones. So they are relaying to me that it is 90 to 120-day wait for their first primary care appointment, not 20-something days. And that's why I ask, if there's more information, we need it.
Yeah, I think it's a great question. I know that when it comes to the transportation network, we always ask that question, what's the nearest site of VA care? Now, you make a great point. A veteran may not know. They may drive right by a site of care and not know that's associated with the VA hospital that they're going to. So, good question.
I'm sorry, Director Ehret, could you please come to the mic? Thank you.
And I know Chattanooga's the same. We have a lot of patients who want to go there. We always say, we can see you at Mountain Home, we can see you at Bristol Clinic, or we can see you usually Rogersville Clinic next week. But you'll have to wait to be seen at Knoxville. Now, I will say that for a new patient, we usually prefer to see them, if they're complicated patients, we prefer to see them at the main campus. They always get their preferred, or hopefully get their preferred clinic. But because if there's something acutely wrong, now, I don't know, about 120 days or 90 days, if there's something acutely wrong, we want to see them where all the specialists are. Because we don't have many specialists at the outlying clinics. They're basic primary care and mental health care.
Can you give me an average wait time of a service-connected Priority 1 veteran that was coming for his first primary care appointment at the VA that he should wait, or that you believe is on your statistics that he should wait?
So it varies by the site of care. But the highest that we have,
I'm sorry, the mic, sir. Thank you.
the highest I've seen in our network for a new patient just wanting that first appointment to get scheduled for care is the average is about 36 days.
Okay, thank you.
Thank you. Any other?
Excuse me, but
That's
and
that's
I
the
think-
average.
I think that he has actually hit upon part of the crust of the issue that we have, in that we have because I'm hearing some of the same things, that the access to care for brand new veterans who are asking for primary care is over 100 days. So I'm not sure how we're coming up with 30 days or 25 days. I don't know all of that. But I do know that even within our organization, when we have, and we're working with homeless veterans, that it has taken us sometimes as long as 6 months to get primary care.
So I would encourage you that when you have a case like that, if you bring it to the leadership's attention at that facility and you didn't get satisfaction, I'd like to know about it. Because, sometimes I hear things like this, and when I go back, there's some real extenuating circumstances when we dig into it. And we have the capability from the network to look at every patient record, and we do it routinely. We go in and try to find the facts of the case. You'll never see me.
But there is no patient record because they can't get
No,
in.
I understand, but if you give me a name, I can see when they enrolled and why they're actually waiting that long for care. I've seen where I've heard those things in the past, and veterans sometimes cancel appointments, and then they have to be rescheduled. I'm not here to defend it. I'm not going to do that. I'm not the enemy of our veterans. I'm there to help them however I can, and I'm not going to get into you tell me where that problem is, and I'll be looking into it to make sure that we resolve it.
Okay. Barry Rice?
I'm part of that real tall line that the director had on their Vietnam veterans. And I think PTSD came into prominence, even though it might have been called something else years ago, but it came in prominence with our generation. And I apologize, I have not had a chance to personally speak with Director Morales, but I've recently understand it. I don't know if it's happening up in the Mountain Home clinics, but they've, in Cookeville, they've completely canceled any PTSD counseling, one-on-one or groups, and are telling our veterans there that they've got to now start coming to Nashville. I mean, some of our Vietnam veterans, and certainly our Afghan and Iraqi veterans, have some issues in that department. And then we hear about the suicide rate. And is this a philosophy, or I don't know if you're closing clinics up in your area, but I'm concerned here with Cookville specifically.
You've created a concern here because I have not heard that. If we lost a provider or two there, that we need some time to replace that capacity. Yeah, it could be a contract change. I'm not sure what the issues are, but we'll look into it. Because the idea is not to pull back access to care.
Well, I'd appreciate anything you can do because I've got some very concerned Vietnam veterans up there that I've heard from recently. So, and again, I apologize. I have not had an opportunity to go see Director Morales about it, so I'm not trying to go over his head. But
We'll look into it.
thank you.
Mental health is a challenge. It's a challenge, for different areas. It's the same as primary care access. There's some sites where we have great mental health access. We have some other areas where it's a real challenge. We are talking about doing a hub and spoke type model here in Tennessee Valley to be able to do telepsych, and we're one of the leaders in the country in using video telehealth to provide care in rural areas. We have a very large number of veterans that come from very rural areas where it's hard to provide care. Telehealth will give us great opportunity. There's some areas where you just can't find a psychiatrist. If a veteran needs psychiatric care, we need to come up with some other ways to get that care to them. Sometimes it takes time to recruit those positions as well. Through this, by having that spoken hub model here at Tennessee Valley, we can provide what I call gap coverage. So they would provide the care until we recruit a physician in that area, and then we would move that patient onto the care platform for that new provider. But we'll check on Cooksville specifically. I'm sure somebody wrote that down for us. Okay.
Yeah, Mr. Patrick, my name is Mary Ross, and I'm with Women Veterans of America, and I really wanted to make sure that you understood that I was not implying that you were an enemy of the veteran. Absolutely not. And I have had many, many, many conversations with Mr. Morales here in Tennessee Valley Healthcare, and actually consider Mr. Morales a partnership in the healthcare that the veterans receive within this area. And one of my focuses has always been with women's health care, and we have made some really good strides in Tennessee Valley in improving the women's health. But what I'm questioning, actually, and I had the privilege of actually being in Washington last week when Secretary Shinseki spoke with the National Coalition for Homeless Veterans, and I think that one of the issues that we are facing is that, number one, with some of the media coverage that we have received, we have lost the confidence and the trust within the VA medical system, and that's going to be a tough barrier to overcome. And I also think that with some of the numbers that are being reported, the fact that we can't identify where those numbers came from in this report that was in the Tennessean, that was in the USA Today, that in itself speaks volumes, and it is not matching, the numbers that are being reported are not matching what a lot of us are seeing on the ground.
Agree. And VA is going to have a website where they're going to post these wait times, where I believe the media, congressional representatives, VSOs will have access to this, so it's transparent to everybody. I heard just before I came here that number may have come from that very website because somebody inadvertently opened the website with old information on it. And as Charlene mentioned earlier, our wait times in the past have been terrible. We've worked really hard to get them to where they're at today. They're still not where we want them to be. But that journey needs to be transparent. And if I'm having a challenge somewhere with access for veterans, then I want to share it with you so we can talk about it together. That's the idea. And thanks for your comments about women's health. We hired a women's veterans health coordinator at the network last year. She's part-time right now. She would like to be full-time. I might be able to squeeze that out
Please use the mic, Mary.
It's about 7% of our veteran population right now. We expect it to grow to be about 12%. I unfortunately do have to go.
I know,
have
and
a
you told me the
meeting at
time at the
2:30,
beginning, so we're
and
there.
it's actually for resources that I hope to be able to bring here to Tennessee and Kentucky. So
Well, we wish you luck in that.
sorry I have to take off. I'd stay here as long as I could.
Director Patrick, I can't thank you enough for coming and speaking with this group who's very, very interested in what's going on in healthcare and the improvements that you're looking for.
Thank you. Thank you all.
Thank you. Oh, yes, John.
Director, tell us a little bit about the system or the process of a new CBOC. Where does their budget come from? Where's the oversight come from? Let's talk about Campbell County as an example. How many doctors, how many nurses,
Will be
admin?
one doctor who we've
One
hired.
doctor.
One
So
doctor.
could it be that
One
the
team.
unintended consequences of these CBOCs nationwide has really caused a, quote, black mark on waiting periods? If the Inspector General goes to, I'll say Campbell County, and they haven't even opened yet, but Cookeville, let me see your waiting list. It could, you're going to wait longer in Cookeville than you are, I would think, in Knoxville, where there are more doctors, more nurses. But it could be that the consequence is their wait time is just thrown the system out of kiln.
Well, I can only speak, I can kind of speak for Chattanooga and for Knoxville, is that our average 8 days includes our Knoxville wait list. But again, 2 years ago, you would have waited 90 days. So, and when I get stories, and I get horrible stories, and I think, how could that possibly happen at my hospital? When I go back and search, it is often much longer before.
But you said that you hope Campbell County can help Knoxville.
Right.
They're not going to offer a lot of help with one doctor.
Well, they can take care of about 1,200 patients. And remember, it's a doctor, it's a nurse, it's an LPN, it's a mental health provider, and a clerk. So you don't have to see the doctor every time. You can, if you want renewal of prescriptions, all of that can be handled. Obviously, if you have a problem, you need to be seen by the physician. But they can handle about 1,200 patients fairly easily. We usually build in, like Sevierville, space to expand. So we started there with 2 teams, 2 PAC teams, and are expanding it to 3 and home-based primary care to meet those needs. I think that the clinics have allowed us to grow, and I think that we struggle to. The good news is patients are happy when they get into our system. The bad news is that we're suffering from our own success.
Let me ask a follow-up. We don't hear a lot about a medical center director in that budget. So tell us briefly, how do you go about preparing your budget? You recommend these dollars to somebody, and I guess it's the vision that you go to.
There is the CBOCs, we're part of the Host Cares Commission, and new CBOCs are harder and harder to open these days. But I believe in VISN 9 especially, we've just about completed all of the ones that we're scheduled for. Any new CBOCs go through a whole different structure through rural health. There are dollars appropriated for rural health, and oftentimes for Sevierville, Campbell County, we got startup funds and usually plus 1 year to start that clinic. And of course, my challenge is making sure that I open my care, my system, to new veterans who result in VERA dollars that come into my budget. We are lucky at Mountain Home that our VERA dollars are increasing because we are, even though we're only 1% increase, our complexity level has increased, our numbers have increased, so our VERA dollars have increased. So that's the hope, is that if you can fund them for 2 years, You know, our budget's 2 years behind. You've probably heard that till you're, makes you sick, but our budget's 2 years behind when we provide the treatment. But if we provide the treatment, within 2 years, we'll get the reimbursement to support that.
The VA budget's gone up every year, I think, that President Obama's been in office, and that's a compliment. There are a lot of agencies that can't say that, but the VA has had a budget increase every year for 5 years, I think, and they're doing a lot with that money. When we lost Ehret Shinseki, we lost a great American, and most veterans realize that. It's easy to get in front of a television and complain about something. My close friend, who was a former commissioner, told me they knew that Ehret Shinseki was going places when he was a senior at West Point, and he certainly did. And we lost a great American when he resigned. Now, the lady that takes his place, they've really got some big combat shoes to fill. They'll appoint someone, I'm sure, and he'll be a perfect person, and we'll stand behind him. They're not every state that has 4 medical centers like Tennessee.
Right.
And we're fortunate in this state. And all these CBOCs that are developing the access, hopefully, it'll all come together eventually. But 87 million outpatient beds nationwide is a tremendous number. So please keep doing what you're doing, and we'll do all we can to help you.
You know, this is the worst thing I've been through in my 40 years of service. I mean, this is brutal, what we go through every single day. And you just think, how much more can you take? But all I have to do is walk out into my hospital, and I know why I have this job and why I love this job. And I will say, everybody who ever had a complaint has come out of the woodwork. They're all coming back. But not today, I got 3 letters from my patients. Actually, I just read one on the way down that said, despite what I'm hearing in the news, you saved my life. And so I'm getting more letters of appreciation, veteran support, than I've ever gotten. But then I know, as I said earlier, that I have to consider that there are veterans out there who would like to get care and who are not getting care and who are not writing letters of appreciation for the care that we've got. So that's our challenge, as Mr. Patrick said, is to provide the access. And again, I said earlier, I wish we could take care of all veterans. If we didn't have to discriminate between Category 8 and Category C and Category 1A and 3C and whatever, and just provide the veteran what they needed, then that would reduce a lot of the bureaucracy in the system. If we just could provide the care, and I wish we could do that, but of course I wish we could take care of families too. So, well, thank you all for having us.
Thank you
and
again,
allowing
Director
us
Ehret.
to vent a little or whine a little, and listening to you all vent. It's very helpful for us to hear what our constituents are saying. I know I hear horror stories every day, and not every day, but a lot of times, and we try to look back and see, oftentimes it was 10 years ago. Time goes really fast, and we are working so hard to improve what we do every day. I look back in 2011, it just wasn't very good.
Let me mention one other quickie here. Mr. Morales' predecessor, about 3 directors before him, said to me, John, the public doesn't realize or understand, many times we don't even see a veteran till he's half dead. Now that's what he said. We don't even see the veteran till he's in such poor health. Should that veteran pass away, we get the criticism. That's haunted me 40 years that he said that. We don't see the veteran till he's so sick, the family, and then they're critical of us when we can't help him. He's too far gone.
Well, and we've really changed the way we do primary care, and I know my time is up, but that's why primary care has been such a focus, is to provide that up front. I must say the most disturbing thing was to hear about the potential of 40 deaths, even at Phoenix. my husband, again, who's a veteran who loves the VA, more than he loves me, I think. I said to him, how could that be? How could 40 patients die waiting? And he said, Charlene, how many patients do you think die every day? He said, if I died tomorrow, get hit by a car, I will have died waiting for an appointment. No doubt about it. Because he gets seen, you know, routinely. He said, no matter when, I'm going to die waiting for appointment. I'm not going to die because I'm waiting for an appointment, but because that has been unsubstantiated. Even at Phoenix, they cannot substantiate that patients died while they were waiting. I read the Louisville or the Phoenix report over the weekend, and I went bullet by bullet to try to see how do we do that, as Mr. Patrick said, very confusing. I don't understand how they did their system. It was very different, but they had a lot of people waiting for a lot of different things that didn't necessarily mean they weren't being seen. They were being seen in the ED and in specialty care, but they had a long list of patients waiting to be seen in primary care. So it didn't mean they weren't being seen for whatever their illness was, but they wanted to get into primary care for that preventive care, and we're waiting. So anyway, thank you all very much. It's always fun
Thanks
to be
a
here.
million.
Thank you.
Thank you. Now, the next part of the presentation, I am going to talk about everything veteran. If you looked at our last annual report, you saw on the cover, it says everything veteran. And I want to talk to you a little bit about what exactly that means. So as we're looking back in time, our department has done an outstanding job in processing claims and in providing the burial services at our state veteran cemeteries. But we want it to be more than that. Now, our budget hasn't grown. Our manning hasn't increased. So exactly how do we really plan to do that? Well, a lot of what we do is really through others. But first I want to show you exactly what we had on our strategic goals. We worked them up last year. We want to increase employment opportunities and business resources for our veterans. As our veterans come home, and even our Vietnam veterans, the last thing that we ever want to hear is of unemployed veterans. Two words that just shouldn't go together. But it is happening, and we want to make sure that veterans understand the resources that are available to them, how they can tap into those resources, and proceed from there. We want to establish a veteran education network. I'm not just talking about a directory where a veteran can find what colleges are available. We want to start there, but it certainly will not end there. A veteran needs to understand what college or higher institution is going to offer me what is best for me. Part of that is matching them up with what their particular goals are, but also identifying what colleges provide different benefits for veterans, and I'll get into that just a little bit more. We also make sure that our claims support is effective and efficient. I'll show you more about this in just a minute, but we want to make sure that while we've been doing a great job, it's not enough. We still know that there are veterans out there that have not been informed about benefits they may be eligible for, and they may not know how to go about applying for them. We want to make sure that our state veteran cemeteries are not only available to everybody, but that they know we have a lot of veterans. Whenever I go speak, how many know that you're eligible for a free burial? A lot of them don't know that. And a lot of the spouses don't know that they may be eligible. So there's a lot of education that is required there. And something that you've heard of a lot lately, and you'll continue to hear more of, and that is our veteran treatment courts. So first of all, the veteran told you that those are two words that should never go together. Right now, the average for unemployment among our veterans in Tennessee is 6.9%. We have seen success, and I will tell you that tracking unemployment among veterans or among anybody is very difficult. Again, you kind of get into definitions, but a good measurement is who's applying for unemployment. And that has decreased by 100 in the first quarter of the year. So we see that as a great improvement. We have established great partners in our sister agencies. I have made personal meetings, set up appointments with my fellow commissioners that may be able to help veterans. And when I talked with a lot of these agencies, they already knew. I didn't have to sell them on what great employees veterans are. They already knew it. And they love to hire veterans. But none of them had made an active effort to recruit veterans. So we talked with First Department of Correction. And in addition to creating a position for a veteran recruiter, they developed a new program. It's a fast track for veterans. And in fact, since our meeting with them, they have hired 80 veterans in their fast track program. So they are thrilled with the results. We are thrilled with the results. That is a win-win-win situation. Tennessee Department of Safety and Homeland Security, obviously they have positions that a lot of military would flow well. They're paramilitary. So we have partnered with them not only for that, but also with those driver's licenses that our veterans can get if they were truck driver for one of the branches of service. So when we invite them to our outreaches, they're not only going to be talking about job opportunities, but when all their equipment is in, they'll be able to do a driving test on the spot, issue that CDL on the spot to the veteran. In addition to that, veterans that might want that veteran-designated driver's license, they will be able to issue those on the spot. And, of course, Department of Correction is also at our outreaches for recruiting as well. Tennessee Department of Environment and Conservation. You may or may not be aware that they have rangers and they have law enforcement within their department. They, again, love hiring veterans, but until we had the conversation, they were not being proactive in finding veterans. So now they are attending our outreaches as well. So we're very excited that not only are we inviting these sister agencies to our outreaches, but they are coming and they are hiring. Veteran Business Resources. We have a friend in Michael Burcham. Michael Burcham is a veteran himself, and he actually approached me when I met him at Leadership Tennessee. And he says, you know, I have this great program to help people that want to start their own business. And then I continue to mentor them for the first several months that they're open. And, you know, we'd had some other conversations, and we went to Michael and said, Michael, what about a boot camp for veterans that either want to start their own business or expand their business? Well, he was very excited about it and has his team modifying their current program so it's just for veterans, and it's in veteran speak. And will be brought out to the veterans where the veterans can find that, and we will help be that conduit. Again, remember, we're not growing our department, but we can help be that conduit for veterans finding anything and everything that is going to improve their lives. I would like to ask Yvette to talk about the portal that we're going to grow with some of these advancements. So Yvette, please.
Well, as Commissioner mentioned, there's several different focuses that veterans have in the unemployment areas of higher education as well as business resources. And they may not realize that there are resources out there already in existence in our state, but because they're housed in several different departments or commissions or nonprofits, they're all over the place. What would be so much easier and so much better is to help bring it into one comprehensive web portal that if a veteran clicks on, I want to become an entrepreneur, or I want to pursue a college degree, or I'm looking for a job, that they'll be able to be walked through the process. They'll get a checklist. They'll be able to then quickly access, not going to 12 different departments or all these different nonprofits, but instead being walked through the process all through this website. It would still tap into different nonprofits and different departments, but they're not going to have to find it and dig for it themselves. Instead, this comprehensive web portal will walk them through it so they can easily find their way through the journey of how to tap into higher education resources, tap into how to find a job, tap into business resources. So this three-prong web portal, we are right now, we have been talking about this web portal, knowing that this is definitely something that our veterans need. However, as Commissioner mentioned, we're not growing in budget and we're not growing in resources. So right now, one of our fellow state departments is working with one of their web geniuses to see if they can help us in creating this comprehensive web portal at no charge. And so it is something that we are currently working on. I don't know how many of you have visited Jobs for TN. Have you ever visited Jobs for TN? Great. Jobs for TN, basically, when a veteran registers on Jobs for TN and an employer then indicates to the Tennessee Department of Labor that they would like to hire a veteran, then their job listing, when it opens up first to veterans. Gives veterans the first opportunity to see this job listing and apply before it then is opened up to the general public. And so many veterans don't know that. Through this comprehensive web portal, they're going to see that. And so this is something that Commissioner was also talking about. We're going to, as we talk about veteran higher education, as Commissioner goes through that, I want to preview that just a smidge. There are higher education institutions that are doing a great job currently in serving the student veteran population. I'm sure that just off the top of your mind, you can name a few. Give me one, Mary. I want to hear. Top of your mind, who is serving the student veteran population the best in the state? Who's a big campus that does that really well? Lipscomb. Everybody thinks of Lipscomb for private, and for public, MTSU is doing a good job, absolutely. And so what came into play, and Commissioner will expand on this a little bit more, is we had Senate Bill 1433, which is our Tennessee Veterans Education Act. And that act passed and was very popular with the General Assembly this last past session. With that, not only did it grant in-state tuition for the veteran student population, but it also created a VETS campus designation. And so those who are currently doing it well will get a designation from THEC, the Tennessee Higher Education Commission. They will give them this designation as being a VETS campus. Of course, that creates the competitive spirit, and with that, we're hoping that more higher education institutions will be inspired and motivated to try to achieve that VETS campus. And that will help the veteran determine who they want to which campus they want to go to because they are currently or they are in the process of serving the student veteran population. Again, that will be something that will be included with the comprehensive web portal, as well as I know many, you've probably heard from veterans, that there are programs out there to where a veteran can take their military experience and turn it into college credits. Well, we're doing a state initiative in partnership with the Tennessee Higher Education Commission to develop the software based on what has already been worked on by THAC to help the veteran to know when they apply for Austin P or they apply for MTSU, whenever they apply to get their college degree, that they are able to see what they will get in college credits walking in the door. And then their advisors will be able to see the same thing. It's all going to be consistent. And so we're working on that, and that's going to be part of this comprehensive web portal. Commissioner?
Thank you, Yvette. So on the Veteran Education Network, you heard me talk before about the Veteran Education Task Force that the governor put together in November. Unlike a lot of the task force that may be currently developed, this one went to work, highly motivated, very focused, so then bring some records to the governor next month. We've got exciting for him. If he, whatever he's in with whatever modification, we'll be sharing those with you as we can. But the governor understood that while veterans were enrolling for higher education, we were not seeing the graduates that we wanted to. And the transition for a lot of veterans is difficult, serving in the combat to being on campus. We've helped identify those. We had veterans that were part of the task force and that were some of the advisors or guests, and we listened to them, and they were a big part in us putting our recommendations together. The student veteran groups, there are quite a few of these associations throughout Tennessee. And most of the larger campuses have these student veteran associations. And it's just veterans at a campus that are getting together, helping each other get through some of the difficulties that they've had in their transition. And through our Veteran Education Task Force, some of these veteran associations, student veteran associations, are now talking to each other. They had not previously. So now that network is growing amongst the student veterans themselves, and I think that's going to help their efforts as well. Yvette already talked about the web portal. On the Tennessee Vets Act, so now we're going to be able to attract out-of-state veterans coming to Tennessee because we will give you in-state tuition. She talked about the fact that we're going to have these vet campuses. I told you on our web portal, we don't want to have just a directory. So these vets campuses are going to be indicated with a star. So veterans are going to be able to go down and say, hey, I know this one's got some great things to offer me. And because of that, we know it's going to help feed the competitive spirit amongst our education services, amongst all the different institutions. So we are trying to do everything we can to encourage more and more benefits. What I would eventually like to see in Tennessee is that we have all vets campuses. And that would just be a great way to attract and keep veterans in Tennessee and maintain them through graduation. On claim support, since we have been here for the last 3.5 years, we have started an effort working one-on-one with our county leadership. as a result, we have increased county service officers by 9 in the last 3.5 years. As you can well imagine, my 25 VBRs in 13 locations just can't quite reach all the 521,000 veterans in Tennessee. So getting these additional county service officers has been great. We've also been bringing them into the automation stage. With some of them, it's been very easy. They're already there. With others, their county leadership either hasn't funded for them to get on to VetraSpec, which is an automated system. In some cases, the county service officer just may not be savvy in technical skills. So, was that tactful? So, we are trying to get all of them to the point that they can file all their claims digitally. And I'm going to give Travis an opportunity to speak here in just a minute, but what we are doing is we want to file all claims digitally and make sure that they are all filed fully developed. Because what that's going to do is that's going to get the money into the veterans' hands sooner. And let's say that last week, one of these county service officers, because all TDVA is now digital, let's say one of these county service officers just did one manually. They sent it in the mail. It was received today. What's that going to do to that veteran's check? It's going to cut it by a month. So if we can get it into the claims office, date stamped, same day, within minutes, that is going to make a difference for our veterans. So for the county service officers, you can see that has almost doubled from January to March, and our efforts, both county service officers and their leadership, we are working toward to be 100% on this as well. And you can see that we have over 2,000 that were filed digitally first quarter of 2014. On Terry's, we have told you about our online registration is available, and so more than 720 of veterans and spouses registered for burial. And again, what this, instead of them trying to scramble, trying DD-214s in time of chaos, it's already, and they can go ahead and plan that and not wait days in order to get that done. So we have also been working toward a new cemetery in South Tennessee, and hoping to make a formal announcement next month or two on that. We are continuing to work and look for facilities in Upper Cumberland for a state veteran cemetery there. So you can see this is going to close those times, and so that every veteran is going to have a cemetery within 75 radius, whether it's state or federal. Veteran Treatment Court, we have been working closely with mental health on increasing awareness about veteran treatment courts. Also been working with them on trying to maybe get a public announcement working on suicide prevention among veterans. But our friends over at Mental Health, they have access to the grants. And so working together with them, because they had already started courts. So this opened the door, and they already had expertise for that would be parallel for our veteran treatments. Of course, for our veteran treatments, a very important facet of is the mental, as you heard Judge Anderson about during our last meeting. So we have partnered, and in Shelby County, Montgomery County, Knox County, we are there when the veteran goes before these judges. We have had one-on-one meetings with a lot of our judges throughout the state. And on the 11th, I will be at the Tennessee Judicial Conference, where all the judges will be in attendance, and I will be talking about the importance of these veteran treatment courts. Maybe we can't get one in every county, but maybe we can have them in districts where they'll be able to group together, or maybe they can at least have a veterans docket. So we want to make sure that our veterans have this wonderful opportunity, because we know that oftentimes what ends the veteran before a judge is behavior that has happened because of their military service. Not a get out of jail free card, but we want to have a second chance for them to become productive citizens. So those are some of the things that we're working on. Any questions of me regarding this? Yes, John.
Commissioner, that's a wonderful presentation. Is the Student Veterans Association organized or not at this date?
Those are organized more at the school level, and as a lot of times the veterans have just kind of found each other in the schools, and so they start talking to each other, and then a lot of the schools have also now started, let's open a vet center, a place for them to hang out, a place for them to use computers, and that draws them together, and then they formally establish their veteran
So
association.
there's no statewide association of student veterans?
There is not.
Okay, thank
There
you.
is not. Okay. And if there's no other questions, Travis, I'm sorry, George?
Yes, Commissioner. Where is this judicial conference going to be held at? And will it be open to the public to, not to participate, but to take in?
I don't believe it is. I'm not sure. But it's going to be in Gatlinburg, and this is required continuing education for these judges. So it may not be, George.
Commissioner, I also noticed George over there very passionately and motivatedly writing, which I'm excited to see you taking such great notes. But I wanted to also let everybody know and remind you, the reports will be posted on the UTVA page. The presentation from Director Ehret, as well as our presentation that Commissioner just gave, will also be on the UTVA page, as well as the video, the minutes, the agenda. And so don't forget, I don't know how many of you went through this in boot camp, but remember in boot camp, when the drill instructor would send out an order, we all had to echo it, remember? Remember that? And so that's what we're asking you to do. I know that Commissioner and I are consistently reminding you, you're hearing so much news today. Please make sure that all of that is getting down to your posts. They need to also be aware of it. We can't reach the veteran without you. It's impossible. Yes, sir.
The web portal, do you have a target date of when you're
I
looking?
was actually hoping that it would be this summer. I'm still optimistically glass half full hoping that it will be launched this summer. But of course, you know, as being somebody that I bombard on my distribution list, that as soon as we do have it up and running and all the bugs have been worked out, there will be a press release, and we will make sure that all of you are aware of that web portal being launched so that you can pass it on to your posts and to all the veterans that you're exposed to.
And because we are relying on the kindness of others, you know, we're at their mercy on timelines. So thank you, Yvette. And Travis, glad to see you here today. Is there anything that you'd like to ask, or did you want to take any questions? Come on. And I think Director McDonald, she's back, right? She is back. So.
She's back. But sure, I can answer any questions that maybe you've got. Is this on?
What's the current number, Travis, of out-of-state claims that your office is now processing?
Well,
roughly.
Roughly, approximately 15,000 is what we got during that large brokered shipment, and we've completed just over 12,000 of those. So we probably have approximately 3,000 claims remaining, primarily from four stations: St. Petersburg, Winston-Salem, Los Angeles, and Montgomery. But we're working through those. We've completed, I guess, out of we've completed over 85% of those claims.
Mike?
Brokering claims is nothing new within the VAROs. How many do we send out from Nashville to other stations to work? I know we send all of the nuclear claims to Mississippi, like if they have exposure to radiation.
Yes, we send out very few claims. We do send our radiation claims, is I believe what you're referring to Jackson, the Jackson Regional Office. We also send the Camp Lejeune contaminated water claims. Those go to Louisville. Outside of that, we did a small amount of, I guess it was development brokering a few months ago, but that was more because of capacity issues. There were some offices that actually needed some work, and so we didn't. We actually sent it to them. We don't necessarily like to do that, but we did because we were asked to.
Are you expecting to get any additional brokered claims in from out of state this year?
I don't believe we will, probably for fiscal year 14. I can't say that.
That's only a few months away.
Well, it is. I can't definitively say that because you just never know. What they're looking at is more of a national workload approach, and they determine station capacity. They look at station capacity, and if there are stations where veterans have been waiting a long time to get service, they will then look at stations like Nashville typically, send those claims to us to work those. I will say, though, the large number that we got, that 15,000, because as you said, and it's true, we've brokered in claims for years, but not in the numbers that we've dealt with in the last 2 years. So I do anticipate, yes, like in fiscal year 15 for sure, I'm sure we'll be doing some type of brokering in. I couldn't say exactly how many or where those will be from, but we probably will do that.
Okay, so maybe we can relate this back to what is happening within the VA healthcare system. If other stations are not functioning at the level that this station is functioning at, by brokering those claims out, are we not rewarding them for bad behavior?
And that's probably not for Travis to answer.
The approach we take on that is veterans that have been waiting in other states, they've been waiting a long time, and we actually support that mission. So we do, when we take those claims, we prioritize them just the way we would a Tennessee claim from a Tennessee veteran.
And Mike, can we make this really short because we have to stop at 3 o'clock.
You've been doing great strides in rated claims. How about with the 686Cs on the non-rated, trying to get dependents added to claims? That's been taking a year, and that's just not acceptable, really.
I will tell you that the dependency claims, we do prioritize those based on the age of the dependency claim. We try to get to the dependency claims that have been pending the longest. We still maintain a non-rating team in Nashville. Some offices actually don't do that. We made the decision to maintain a non-rating team that handles those types of claims. I will tell you, timeliness does need to get better, but we're working on that to prioritize things.
Okay. Thank you, Travis. Oh. Okay, thank you, Travis. Appreciate it very much. Wendell just asked that and reminded me that I should tell you about our latest county service officer that we have finally convinced a county to hire. That is right here in Davidson County. And this is the first time that Davidson County has had one in 39 years. So Lisa Kiss, who used to work for Stand Down, who's now working for us, is going to be the next county service officer. Since their HR office is paying that salary out of Hyde, that position will be working out of their HR office. So Parkway Towers, just around the corner from here, James Robertson Parkway and 4th is where she'll be working. And she will start there on the 23rd of June. So we've been working very hard at getting that one, and it has paid off. So very excited about that. I would also like to thank those of you that have provided reports, because, and I would like to please ask, encourage you, beg you to provide those in advance so that those can be provided at the meeting. But even those that we've received today, we will have on our website for everyone to see. And that way, everyone will know what everyone else is doing. And as you all are making your plans for conferences, it really does help if you know what the other groups are doing. You don't leave gaps, you don't overlap.
On the ones that were brought today, please send those to me electronically so that I can get those posted on the website.
Very good. Do we have any unfinished business? Any new business? Okay, I'll go first, Frank.
I just want to remind everybody about the report that I passed out to everybody. I won't go over it since you already have it, and it's on the website, about our activities through the months of in the DAV for processing claims and transportation network for the months of February, March, and April. And also our convention, state convention for the Disabled American Veterans is going to be the Doubletree Hotel in Murfreesboro, Tennessee on June the 19th to the 22nd. That's coming up just shortly here. And then the week prior to that, the American Legion is going to be having their convention at the Crown Plaza Hotel in Knoxville, Tennessee on June 12th through the 15th. So that's coming up even quicker. So.
Okay, you all have those notes, and you can refer to them at your leisure. Bill, did you have something? Come up to the mic, please. Make sure it's on. Is it on?
Thank you, Commissioner. I just wanted to make everybody aware of two events coming up. The Afghanistan Veterans Day Parade on Saturday, June the 14th here in Nashville. That's the first time Tennessee's had a parade celebrating any particular era of veterans other than the Desert Storm Parade back in 1991. And, of course, we have the Veterans Day Parade every year in November. And secondly, June the 26th, 27th, and 28th, the Vietnam Wall will be at Bicentennial Mall. It's part of an effort that's being led by State Senator Mark Green to round up pictures of all the Tennessee veterans' names on the wall. And should be more out on that, but the wall will be here at Bicentennial Mall that weekend. Thank you.
Thank you very much. Any other new business? Yes, John?
Commissioner, I just want to make a historical moment here. It was in this very room, this very chamber, May of 1979, that UTVA met for the first time. So we have 35 years in the book, and I'd like Ms. Martinez to get me a copy of those minutes so I could have those. We meet quarterly, so this is meeting number 140. I'm sure you've got all those digital by now. But Commissioner, thank you for what you're continuing to do. You're doing an outstanding job. I've told you that more than once. And I'm not blowing smoke. I hear it from our members across the state, and we're grateful. The governor has given you what I gather to be 100% support. The budget, the people you've been able to hire, a great deputy in Wendell Cheek, first one we've ever had as a department. And I hired Don Smith, so I'm very proud of Don Smith over in the east.
We are
Sergeant
too.
Major in the west, and Yvette here. So please keep up a good work.
Thank you. It's an honor and privilege to serve you, to serve our veterans. So thank you very much. With that, do we have a motion to adjourn? Second? All in favor? Oh. Yes, September 9th. We talked about that earlier, but please. That's okay. That's okay. George, last chance.
Okay, Commissioner, thank you. This is AMVET, State Department of Tennessee. State President or Commander Curtis Rust, we had our SEC meeting in March at Paris Landing. He announced it has been determined that the state convention will be held in Paris next year, and this June 5th through the 8th is our state convention being held in Gatlinburg at the Glenstone Lodge. Thank you, Commissioner.
Thank you. So all in favor of dismissing indicate by saying aye. Are there any opposed? I didn't think so. Travel safely. Thank you so much. And see you next meeting, if not sooner.